Welcome to the case study about non-specific lower back pain and how the use of kinesiology tape worked really well in conjunction with other modalities to help this particular client. So let's begin with a subjective assessment. This particular client is a pharmacist. She is postnatal that's had 2 vaginal deliveries a year ago and also 4 years ago. She's had lower back pain from as long as she can remember. She remembers this before pregnancy when she was working, but it did get worse during her first pregnancy. During her first pregnancy, she did see an osteopath to help with this, and the symptoms did reduce. She mentioned that the osteopath had also said she had a leg length discrepancy. She notices that symptoms are worse when she's bending forwards and then returning from that, especially when she's sat down doing things such as putting on her shoes and also first thing in the morning. She finds it more on the left side, but it does vary from day to day, so the pain does move around. So she finds it sometimes around the sacral area, right up to the mid-thoracic, but it does move around. She's been a regular yoga participant for many years, but hasn't done exercise for quite a while. She's a bit scared about hurting herself and making her back worse. In her standing assessment, we noticed that she has a lordosis, or presenting with a lordosis. Her ilium on her left side is elevated, which is more prominent when she's walking. In a seated position, her thoracic rotation to the right is reduced compared to the left, and she feels that that's stiff. When she is standing, the rotation improves, but it's still different from left to right. Her lateral flexion to the right is also reduced. When she does have forward bend, it's initiated from hip flexion rather than spine flexion. Her hip external rotation on the left is reduced, and she finds bridges really painful on the initiation of the movement. When she's up in the position, she's fine, but it hurts to start with. All the special tests came back negative, so there's no neural concerns. But on palpation, there's some tenderness around the left QL and the glute attachments around the sacrum. We also assessed how she breathes, and in her breathing assessment, she's only really able to get apical breath, and there's little movement in the lower ribs and in the abdomen. So based on the assessment, we found that the client is potentially experiencing non-specific back pain as the pain moves and varies, and there's no causation of the pain. Based on the range of movement assessments and other movement assessments, we noticed that her left QL is perceived short, and also the external rotators of her glutes as well. Her external oblique on both sides are also restricting some movement, which is causing a bit of a rib flare in that position as well. So for this particular client, the goal for the short term is about decreasing pain and sensitivity to the lower back. We want to improve the range of movement of her spine and her left hip, activate her glutes, TVA and RA, and also focus on her breathing. Long term is to strengthen her whole body, and she wants to be able to return to sun salutations and feel strong doing them. And one thing she noticed would be a factor in knowing that she's getting better and feeling better is she wakes up in the morning without any pain. So that's our goal, to help her with that. So in the first treatment, the goal is to decrease pain and desensitization. So that looked like soft tissue work around the whole of the back, the glutes, the hamstrings on both sides, but particularly working on the right side using techniques such as METs and STRs. We also worked on some work around the intercostals, diaphragm border and obliques to help calm the area down. I also used some kinesiology taping with this client for the lower back to desensitize the area. We looked at improving the range of movement with the soft tissue work for the spine and the rotators of the hip. And then for our home care, we focused on some Pilates single leg slides, a QL mobility, and also a foot to core activation exercise as well. And we recommended we integrate those exercises into her program every day for the next week. And here are just some of the examples of what I did with this particular client. So that's the example of the taping. So I used the SI joint pain taping for this particular client. So just refer back to that video in your musculoskeletal library to refresh on that one. And then I used this QL mobility for my client, which worked really well. And the focus is about reaching up and over with the ribs, keeping the pelvis still by having one leg slightly further back. And this is an example of the Pilates one leg slides to really help her focus on that kind of pelvic stability and also TVA activation, which worked really well for this particular client in the very early phases. So when she came back in session 2, we noticed that the pain had decreased a lot in her lower back, and bending forwards had become a lot easier. And she was able to demonstrate that at the beginning of the session and actually felt really good. She also commented on how strong she felt in her core already from doing these exercises, which I think is helping her decrease in that pain. In the reassessment, it demonstrated there was still some pain on the palpation on that QL, but it had decreased, but the hip hike is still present on this side. What she also noticed that she had been feeling pain in the left hip when she was doing a hip stretch on the right side. When we looked at this, there was no pain when she activated the glute medius, but the range is limited, so we focus on that in this session. So in this session, we focus on improving the range of movement through some more soft tissue work, spending a lot more time around the hip and sacrum area. I also used some kinesiology taping for her left quadratus lumborum, and then some different glute medius exercises to add in daily. And I've seen her for the third time, and the QL is feeling a lot better. She's got more ranges of movement in there, which is great. The symptoms of pain she was experiencing when doing the stretch in the hip has also decreased from doing the exercises. So as you can see from this particular case study, we use kinesiology taping as a small part of the treatment, one to help desensitize any pain, but then also to inhibit the QL to help increase that range of motion. It wasn't the only thing we used in this treatment. So I used soft tissue techniques, some exercise techniques, instrument-assisted soft tissue therapy as well, but the combination of all of them helps this client feel a lot better sooner.